All right, this is the room. We'll be over here. Set this up. All right. So I come in, knock. Hand hygiene. Hi, my name's Tony. I'm your student nurse today.
Okay.
Can I get your name and date of birth?
Jack Garbodin, 7/18/02.
Okay. Today I'm gonna be doing a head-to-toe assessment on you. Is that all right?
Yeah.
Okay. And then, are you comfortable?
Yes.
Okay. And then, do you have any allergies or anything?
No allergies.
Any past medical history?
Nope.
Nothing?
No surgeries.
No, nothing? Okay. So I'm gonna go ahead and get started. We'll go ahead and do vitals.
All right.
So I'm gonna use this one. We'll do this. And then while that's going, I'm gonna do temperature real quick. All right, temperature's 98.6, which is fine. All right, SpO2 is showing 100%, which is perfect. And we're just waiting on blood pressure. All right. Blood pressure is 120/80, which is perfect. Take off here. And then I'm gonna do pulses real quick. I'm gonna use this phone since mine is obviously recording. Got that. All right. All right, so his pulse would be 70. That looks good. And then I'm gonna do respirations real quick. I'm gonna use the same timer. All right, just go ahead and just breathe normally for me. Respirations were 16, so that's fine. And then, do you have any pain right now?
Yes, my head hurts.
You have a headache, all right. And then, how long has this headache been going on?
2 days.
2 days. And then, where on your head is it hurting?
Like right here.
Right on the sides, all right. And then, can you describe the pain? Like aching, dull, sharp?
It's dull.
It's dull, okay. And then, is there anything that makes the pain worse, or
Bright lights.
bright lights? Anything that makes it better?
Laying down and being in the dark.
Laying down, being in the dark. And then, have you done anything at home that's to help treat it? Like
yeah,
medications?
I've taken ibuprofen.
Ibuprofen. And then, can you rate your pain on a scale of 0 to 10?
5.
5. All right. So that wraps up vitals and pain assessment. Have you had any like headaches recently or anything other than that one?
Besides that one, no.
Okay. So we'll go ahead and do neuro. I'm gonna start with how'd you get here today?
I drove here.
You drove here, and then do you know what today's date is?
I know that it's Wednesday.
You know that's Wednesday. Okay. So I'm gonna go ahead and start with inspecting the head, hair, and scalp, all that stuff. So hair looks fine, scalp looks good, no discoloration. And then we'll go ahead and do face symmetry. So can you go ahead and smile for me, and then frown, and then raise your eyebrows, puff out your cheeks. All right. So face is symmetrical, everything's looking fine. And then I'm gonna go ahead and do TMJ. I'm just gonna feel behind your jaw and then go ahead and open and close it for me. All right. And then do you have any pain while you're doing that?
No.
No pain? Okay. So then I'll go ahead and I'm going to start with the eyes and then I'll do the rest, okay? So I'm gonna look at the eyes, look for any drainage, discoloration. There's no drainage, no discoloration. So I'm gonna start with Perla. Just go ahead and look straight forward. All right. That one dilated. All right. Then go ahead and follow the end of the pen for me. All right. So pupils are equal, round, reactive light, and accommodating. So then I'm gonna do the cardinal fields. Go ahead and just follow the pen. All right. Just make sure to keep your head same spot. Just move the eyes. All right. All right. Cardinal fields are good. And then I'm gonna go ahead and look at the nose. So go ahead and just look up. I'm looking for any excess mucus, drainage, all that stuff. Hair looks fine. Everything's good. And then I'm gonna do your mouth. Open your mouth and just say ah.
Ah.
All right. Teeth look good. No extra stuff in there. And then I'm gonna do your ears. So go ahead and turn this way. All right. No discoloration. All that. No drainage. All right. And then can you go ahead and swallow for me? You have any pain doing that? No pain. And then I'm gonna have you move your head down and back. All right. And then side to side. All right. And then lift your shrug your shoulders, okay? And then I'm gonna just push against my hand, test the strength. All right. No pain with that?
No.
Okay. Have you had any recent hair loss or anything?
No, I have not.
No. Any other, like, has those headaches been going on for a while?
No, this is just a one-off.
Just okay. All right. So we can go ahead and wrap that up and be good with that. And then we'll go ahead and move to respiratory, all right?
Okay.
All right. So respiratory, I'm going to start with the anterior side. Obviously, he has a shirt on, so we can't look and see for symmetry and all that stuff, discoloration. But I would do it on bare skin when I'm listening. All right. Go ahead and listen. It's got 8 spots on the front.
Okay.
Just keep breathing normal. All right. Okay. That's one. All right. Breath sounds good on the front, no wheezing, none of that. And then I'm going to have you go ahead and stand up and face the wall over there. I'm going to listen to the back. All right. Back side's got 10. So go ahead and continue to breathe normal. All right. Last one. All right, back sounds fine also, no wheezing, none of that. I'm going to ask you a couple questions. Do you have any chest pain, difficulty breathing, any of that?
No chest pain and then no difficulty breathing.
Have you had any respiratory problems in the past?
No.
Any family stuff with that?
No.
Okay. So that'll wrap up respiratory, and then we'll go ahead and do the heart, okay?
Okay.
So for the heart, I will be listening to 5 points. I'm going to start with listening with the diaphragm and then do the bell after. All right. And also he has his shirt on, so I would be looking for any discoloration, symmetry, all that stuff, any lumps or anything, any accessory muscles with breathing, and also I would be listening on bare skin. So I'll start with aortic. All right. And then I'll do pulmonic. Then Erb's point. And then tricuspid. And then mitral. All right. All those sound good, and then I'll flip this over, and I'm gonna do it with the bell, the same spots. So the aortic, no vascular sounds. Pulmonic, no vascular sounds. Erb's point, no vascular sounds. Then we'll do tricuspid and mitral. No vascular sounds there either, and then mitral, no vascular sounds. All right. So all that sounds good. All good with that. And then, have you had any chest pain recently?
No, I have not.
Okay. And then, does you get any pain like when you're doing exercise, shortness of breath, any of that?
No pain with exercise and no shortness of breath.
Okay. All right, good. So that's all good. We'll go ahead and move to the upper extremities. So first, I'm gonna start with feeling for temperature, and I'll be looking for skin color, discoloration. So temperature is warm, skin looks good, intact. I'd also look for hair distribution. All looks good. First, I'll do the edema, both sides. No edema either side. All looks good. And then I would do skin turgor. Feel for that. Skin rebounds, elastic, all good, less than 3 seconds. Same with that. And then I would do capillary refill. So feel on this side, look on this side, less than 3 seconds on that side, and then less than 3 seconds on that side. And then I'm gonna do the pulses. Make sure they're both equal. All right. +2 equal bilateral on both sides. And then I'm gonna feel for grip strength. So I'm gonna go ahead and just have you grab my fingers. All right, that's good. And then we'll do range of motion. Okay.
Okay.
So all you'll do with both shoulders, you'll raise them straight up. That'll be your flexion. Any pain?
No pain.
And then we'll do extension, which is straight back. Any pain with that?
Nope.
And then last one will be just a circumduction, which is kind of a circle. All right. All good?
Yeah.
No pain with that?
Nope.
Have you had any swelling recently?
No swelling.
No problems with like moving your shoulders around and range of motion problems?
Nope.
Other than that, we're good. So then we'll go ahead and move on to lower extremity. Move this over here. Should be good. So kind of like the same for upper extremity, but obviously. So he has pants on, so I obviously can't look and kind of feel for temperature or any skin discoloration. So I would be feeling for temperature. He'd be warm. Look, there's no problems with skin's intact. And then I would look for the hair, make sure there's no any abnormal distribution of that. And then I would go on his shins. We can raise these up a little bit. So on his shins, I would feel for tibial edema. So I press in, make sure that rebound's good. That's all good. And then I would do skin turgor. I would feel on both sides, make sure bilateral. All right, that's all good. Rebound's fine. And then we're gonna do the feet. So he has shoes on, so we can't obviously do the capillary refill, but I would grab his toes, squeeze, look for capillary refill, make sure less than 3 seconds. And then I can do the pulses. So this one on top is dorsalis pedis, feel for that. Make sure they're both equal. So it'd be +2, equal and bilateral. And then I can do the posterior tibialis. So I feel for that. I can feel those. Those are both +2, equal and bilateral. And then I'm gonna do strength with your feet, okay?
Okay.
So first I'm gonna put my hand on your foot and you'll pull and then you'll push, okay? So you'll pull it and then push, all right? Good. And then pull and then push, All right. So those are good. All that's fine. And then I'm gonna do range of motion. Okay. So
Okay.
I'm gonna have you stand up, and what you'll do is move your leg just like this, hip circumduction. Do it on both sides. All right. Both of those are good. And then you'll kind of turn to the side and you'll just flex your knee back, right? And then extend it forward. All right. Do the same with the other side. All right. And then, do you have any pain doing that? No pain?
No pain at all.
Okay. And then have you had any problems like walking around?
No.
Okay, sounds good. And then last thing we'll do is the abdomen. Obviously he would be laying down for the abdomen, but we can work with what we got. So first I'd inspect, look and see for any discoloration, lumps, bumps, scars, and then I would listen. So listen to the 4 quadrants, 5-10 seconds. All right. All right, no abnormal bowel sounds, everything sounds fine. And then I'm gonna palpate and feel for any lumps or any abnormal things. And then, is there any pain or tenderness when I'm feeling around?
No.
No pain or tenderness? All right. And then when was your last bowel movement?
Earlier today.
Earlier today. And then, have you had any other problems?
No.
Any other bowel problems? No, nothing?
No.
Okay. And that pretty much wraps it up. I'll talk to the doctor, make sure everything's good for you, and we'll be back and get you going. Okay.
All right.
All right. Thank you. I appreciate it. And then I would walk out of the room, wash my hands, walk out of the room, and then we're good. All right.